The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom, and I got a great program for you, as I always do, and we're going to get into it in just a minute, but I want to remind you that, the things that we do here are to guide you into taking full control of your life. That's why we call it Ageless Health. Your health is a do-it-yourself program, by the way, which was the title of my first book back in the day, and it's still available on audio version and so forth. You should be able to find it. Having said that, we're going to get into something that is extremely common. We've been talking about headaches, but I want to talk about a headache that is totally about you're doing the wrong thing. And what we're talking about is that hangry headache, that angry, that want to bite somebody's head off and, snip at them a little bit. It really comes down to the fact that you are not taking care of your body the way you're supposed to be taking care of it. You're not eating properly. You're not keeping the fuel in your system. There's so many of you that are going forever without putting food in that when you finally get to it, you're putting the wrong types of foods in. So we're going to touch on those ideas, if you will. But a hangry headache can be mistaken for all kinds of things, from migraine headaches. It can be, it feel like a sinus pressure. It could feel somebody's like a claw the back of your head and just squeezing tight. Your eyes hurt, and you start misconstruing them for all kinds of things. But what it really has to do with is a stress pattern that's induced by low blood sugar. And it's often because either you're not getting enough, if you will, you're not getting enough protein in your system. You're not getting enough calories on a regular basis. You're not getting enough hydration and so forth. But we'll talk about that and what it really is. But it triggers all kinds of pathways. If you allow those stress levels to get too high, then what happens is your hormones get crazy and you wonder why you're not feeling good. And guess what you usually do? You go grab a candy bar, or you go grab a cup of coffee, or you go grab something that's a stimulant to upregulate your body, to get your head clear. The problem is it ebbs and flows, and then pretty soon you crash again. Not okay, because you just get deeper into the hole. So visualize this, right? If this is normal, here's a normal threshold. And anything at normal or above is kind of where you want to be. And all of a sudden you're tired, and it goes down. And then you do something to get you back up to normal. Sometimes it's a cup of coffee. Sometimes it's a soda. Sometimes it's a candy bar. Sometimes it's, getting some other type of stimulant that you shouldn't be doing anyway. But then it kicks you up, and then what it does, it crashes again. Then it kicks you up, and it crashes. You keep doing this thing. But what happens is that peak up gets it never hits that normal again. It's better than where you're at, but pretty soon you crash all the way through, and you set up a cascade of all kinds of problems. But that lousy headache, that hangry headache, that I want to take. I saw a cute T-shirt that says, please excuse what I said when I was having my hangry headache. Well, you can fix those, but you have to take action steps and realize that it's a do-it-yourself program. You're the one that brought it about. So let's talk a little bit about that hangry headache and what it really means. So a hangry headache, it occurs when the body has not had enough to eat, period, end of story. You need fuel and you're not giving it to it, right? It leads to a drop in your blood sugar. And I don't mean you need to go out and get sugar to make it come back up, because sugar that your body needs is called glucose, and it's derived by a storage called glycogen, and it has to do with protein metabolism and so forth. So have I confused you? Well, here's the deal. The triggering mechanisms can range from all kinds of stuff, but it can show up as head pain. It can show up as muscle tension. It can show up as even nausea. You feel like you want to throw up. And what does that got to do with headache? Well, it has to do with what we're talking about. The problem is you're not getting. How about those of you that you would go way too long without eating, and then you sit down and you eat something. You grab a sandwich, and then you want to go to sleep afterwards. If you sat there, you want to crash. So Is that normal? No, absolutely. It's not normal. So we have to understand the depth and the breadth of this thing. So here's the deal. Chronic low blood sugar, if you will, can cause dull, throbbing type of headaches and all shakiness and fatigue. And here's why it's called hangry. You can get irritable as all get out. And then your vision changes. You get blurred visions. You don't recognize anything out there. You say, why am I seeing triple? Double anyway. So headaches from low blood sugar, typically it's called, the term is called hypoglycemia. And they're very dull, and they may affect both sides of the head. They can affect the front of the head. As I said, they feel like somebody's got a grip at the back of your head. It can hit in the temporal area, across the frontal bone itself. And these silly headaches then can lead into things that trigger migraine type of headaches. And these appear when blood sugar crashes. It drops down and below normal levels. Now, if your blood sugar level at that point is not 70 milligrams per diluted liter on the blood sugar level monitor, you're in trouble. It's just as bad as it being way too high, because you can have both ends of the spectrum causing you issues. The pain generally will resolve once your blood sugar level is corrected. Now, we know that diabetic patients, if they're over medicated, they drop, and they can get a lot of these symptoms and go into a hypoglycemic headache pattern. Now, how do they fix it? Well, they give them some orange juice, they give them something like that. But here the problem is that that's only an emergency situation, but you better stabilize it very, 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 very quickly, because other situations will come about. Look, we got takeaways from this, right? So what am I talking about? So first of all, a blood sugar headache is something that feels dull, and it can throb, and it can affect the temples or the back of the head or up here in the frontal portion in the temple area. How do we deal with it? We got to eat more often, but we have to eat the right things. And we'll get into that today as we go through the program, because if you're not eating well, if you're not getting enough protein, if you're not hydrated the way you're supposed to be hydrated, you got a problem. So we have to say, what's that balancing act? What do we have to do? You go to the doctor and say, well, you got to eat every 2 hours. Yeah, but that doesn't mean a candy bar every 2 hours. It doesn't mean drink a soda every 2 hours. It means that you have to actually begin to repair, refuel, and put things back into the system. When you get a headache, when your body's blood sugar level drops, and generally, as I said, the benchmark is around 70, 72 milligrams per diluted liter. Look it up. It's right there on your blood test. And it tells you that your body's into a hypoglycemic state. So some of the symptoms, we're talking about blurry vision. You can even have an increase in your heart rate. Your heart starts flipping around like crazy. And you can get nervous, you can get jittery, you can get irritable, you can get confused, you get really tired, and you want to hurt somebody. Because that's you being aggravated, and you want to bite somebody. And so there's a lot of reasons for that, but we won't get into that at this moment. So if your blood sugar level isn't stable, above 70, stable, I mean, that doesn't move, way up, way high, or way down, you're going to have things like numbness, tingling, you can't concentrate, you have poor coordination, and even to the point where sometimes you'll pass out. And when it gets really bad, when it really drops, the end game, you can actually go into coma. Yeah, you can. And fortunately, it's rare, but you get into this catch-22, because now you go into trying to figure out how to fix it. And your general allopathic physicians say, well, just eat anything. Just make sure that you're eating all the time. Not so much, because then you're going to get yourself in a different platform. But a hypoglycemia, low blood sugar, that triggers a migraine headache is something that says that it's causing an inflammatory reaction in the blood vessels. Now, here's what happens over time. When that takes place, the muscles behind your head contract tightly, and now they cause a muscle contraction headache on top of the inflammatory reaction that you're already experiencing. So it's like a self-perpetuating cycle that continues to take place. Now, you can either get into a place where you have nausea and vomit, and that whole sensitivity to light, the migraine typical twinkle, twinkle, little light type of situation. It's very, very straightforward, but it doesn't answer the question. If you say, oh, I got a migraine, where it's coming from. It's like, clean your diet up. Let's figure out what we got to do. Now, if you have diabetes, if you're into that place, it's important to follow, medical plan until that's stable, because you can't just, drop food out of your system. If you do that, you're going to cause yourself other problems. Fasting too long, and we're going to talk about that today. All of this, these long fasts, 10 hours, 12 hours, 15 hours. Some people are even, going up to 16 hours. They only have a 6, 7, 8 hour eating window. Not okay. This is Dr. Tom telling you, not all right. You have to make sure you're looking at the dietary patterns. What happens if you're getting alcohol in your system on an ongoing basis? That's going to cause you problems. So you have to look at those things. The medications that you're taking often will trigger some of these things. Look, you have to balance carbs. You got to have some carbohydrates. Those are your vegetables, and those are your hard cut grains and so forth. But I'm not talking about wheat grains. I'm talking about other things, and we'll touch about that in a second. So you have to be someone who is cognizant and not just directed. Today's world, I'm finding out from our patients and from people that I talk to, where I teach and so forth, that people truly want to take control of their life, and they want to be able to put things back in their own hands. Well, this is why we do the program. This is why we put all this together and try to make it happen for you, so you understand that you have control. Now, listen, I want to invite you. Coming up basically about a week and a half here at the Roselle Center. It's going to be the 18th at 6 p.m. at the Roselle Center in Fairfax. We're going to be talking about chronic headaches, migraines. We're going to talk about this type of headache as well. We're going to talk about that hangry, you want to hurt somebody type of feeling. But more importantly, we're going to give you tools to have this cleared up out of your system. By the way, I want to answer somebody who wrote in and asked about our classes in house. They said, well, you do these classes, to bring patients into your clinic. And I said to them, we do these classes to let people know that they have an option. So when you come to the office, when you come to the class, we're going to give you a ton of data, all kinds of stuff. But we're not going to exchange with you relative to you have an obligation. You don't have an obligation. You just come and listen, take notes, take pictures of the slides, and ask questions, because we always hang out and we'll answer your questions. And by the way, if you go to our website, you go to rosellecare.com, ROSELLECARE, rosellecare.com. You go to the top, it says that we're inviting you for a free 20-minute consultation. Free. There's no strings attached. Just say, hey, I'd like to talk to one of the docs at the Roselle Center and ask some specific questions about my condition. It doesn't make any difference what it is. It could be the migraines we talk about. It could be cancer. It could be diabetes. It could be, numbness in your feet, neuropathic problems, anything like that. I'd like to ask some questions. And one of our guys will call you. They'll get on the phone with you. Just say, hey, this is a good time to call me. And they'll get on the phone. They'll call you. They'll answer all your questions. Again, no obligation. So, our listener that said, hey, this is just a solicitation. No. Is you have no obligation whatsoever. I want you to know that. I want you to understand that all we're doing is giving you data. If you choose, to come in, different story. And by the way, I want you to know on that, and I'm going to go further to this person's question. If you come into any of our in-house classes, because you took the time, out of respect for your life and taking the time, if you would like to come in, we do reduce our initial fee. And that's our gift to you. That's what we want to do. Because why? Because we know things work without drugs, but we're not going to twist your arm. We're not going to say, hey, do this, but it's all yours. Nobody's going to do a hard sell. This is not a timeshare situation. So join us, okay? And walk away with data, walk away with information, ask us questions, and I'll say, bless you. See you later. Call me, if you need any further information. Let's get back into what we're talking about. We got a lot of data to cover today, and I want to make sure that you get it right, if you will. Okay. So let's get in a little bit into this symptom process. And we talked a little bit about, the shakiness that you get and the fatigue and the irritability and the blurred vision and that pressure that you have in your head, particularly in the temporal area here and across the front of your head. And it comes all the time, generally after you have not eaten properly and you're either putting the wrong things in or you've gone way too long without getting the food that you need to get. So please remember that. So as we go through the program today, I'm going to give you all kinds of data, all kinds of information that you can do immediately. We're going to tell you how much protein that you need to have. We're going to tell you, how to balance it, with it. You didn't have to go to our nutritionist. You're just listening to me. If you did, what I tell you to do today, you're going to be good, right? You're going to be really good. So what's the most common problems that people have that can cause all kinds of health issues? One is we don't eat the way we're supposed to. We eat garbage, particularly here in the good old United States of America. Our foods are banned virtually everywhere. And, when you go outside the country, you taste food that you can't eat here, but there you can eat there. Why? Because it's put together differently. So that's number one. Number two, we don't drink water. And when we do drink water, we drink tap water. And what's in the tap water? Well, the tap water, there's chlorides and there's fluorides, things that you should be putting in your system. In addition to that, if you live in like where we are in the Washington, D.C. area, and your water's not filtered, you're in a water reclamation area. That means they take your sewage water. God, we had a problem with that with Potomac, right? We take the sewage water that goes into your toilet, and then they reclaim it. They reprocess it. They take all the junk out of it, except they don't get it all out. And one of the things that they don't get out are hormones. And now, guys, you drink this water. Ladies, you drink this water. And guess what? One of the substances that they can't get out 100%, it's called estrogenics. Now, when you have estrogens rising, they're going to cause inflammation. They're going to cause swelling in the tissue, the brain tissue, the vessels of your body, and so forth. But they're also going to potentiate the possibility of cancers because they're not blunted. You have to have natural hormone that you make, and you have to have enough estrogen and progesterone to balance each other out. But if you're getting all these xenoestrogens, that means estrogens outside of your body, outside of your environment that are not filtered, and they don't have any progesterone to balance them out, you got a problem. You're going to trigger the potentiality of all kinds of stuff. So as we get into these hangry headaches, and we talk about what they are as blood sugar, problems, that because you're not eating enough protein, you're going way too long without eating, you're stressed over the top, and you're affecting your whole body's metabolic pathways. So if that's the case, can you do anything about it? Absolutely, 100%. And we'll get into that as the program goes on today. But again, I want to invite you, coming up March 18th, join us, and I'll give you more information than you thought was possible. So Dr. Zhang, as many of you know, is a TCM practitioner, traditional Chinese medical doctor, who also is a chiropractor, who also is a natural health physician. And it will be amazing. Listen, if you go to our website, you go to drtomroselle.com and go to Ageless Health Store. If you go into the Ageless Health Store, you're going to see echo filtration units. They will increase your hydrogen capacity in your body, so it's going to detox you very nicely, and it's going to clear out a lot of this junk. Just check them out, and it's all there just for you. And remember that you go to the Ageless Health Store as well, and there's a way that you can buy nutrients. And some of the things I'm going to talk to you about today, if you're not in the Washington metropolitan area where you can't get in to talk to us, there's a good site where you can buy clean nutritional products, and that we don't have a problem with you picking up. So check that out. Go to drtomroselle.com, go to Ageless Health Store, check out the echo filters. You can get them, for the house. You can get them just a little bottle to carry with you. But I promise you, I've got them. We have one at the house. We have one here at the office. I carry a filter with me on, most everywhere that I go, except when I'm flying and traveling and so forth. And look, it's up to you to take care of yourself. It is truly, totally in your hands. Health is a do-it-yourself program. And that's what we're going to talk about as we go through today. We're going to tell you how to fix some of this stuff. I'm going to tell you the dietary pieces and so forth. We're coming up to a break, and this is an important program for you, but don't go away. I have so much more that I want to give you. You're listening to Ageless Health with yours truly, Dr. Tom. I'll be right back. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com. Hey, everybody, welcome back. This is Ageless Health with yours truly. Ageless Health, right? Interesting couple words. It simply means this, that your body should not deteriorate. You should not suffer the slings and arrows of so many things that we do. Why is that? Why do we do that? Why do we end up in trouble? And the reason is because it's usually by our decisions not to or our decision to do. And, your body was designed to be able to handle virtually anything that happens to it. But we end up putting things in our bodies that we struggle to have to process and metabolize and so forth. We stress like crazy. We don't learn how to meditate or even pray to our Creator on a regular basis. We do these things on an ongoing basis. And what happens is that our body begins to deteriorate. We get hurt and we say, well, we'll get over it. So we take NSAIDs, non-steroidal anti-inflammatories. We end up doing things that blunt the situation and thinking it's normal. I'm here to tell you that cancer is not normal, and headaches are not normal, and irritable bowel syndrome is not normal, and the rashes that you have in your body are not normal. The degenerative spinal conditions that you have are not normal. There's ways of reversing a lot of these things if you are aware that, number one, you had your fingers in the soup initially and that you were, swirling it up. Now, you can say, well, doc, I had a car accident and, I got banged up. Yep, that's true. So you're still living, right? You're not paralyzed, but you just don't feel good. You're weak and so forth. And you can't get out of it because you're taking drugs to blunt it instead of doing things that can repair it. Now, we're talking about headaches. What does that have to do with anything? We're talking about that hangry headache, that inability to stay calm, the dizziness that takes place, the inability to focus, that throbbing in your head that just won't stop. It's like somebody's got a vice grip around the back of your head. All of those things are not normal. And so when you hear the advertisement, take this for your normal headache, there is no normal headache. I promise you there's not. It's there on a common basis because of the things that we do lifestyle, but it is not normal. It shouldn't be there. On the 18th of this month, coming up pretty quickly, about a week and a half from now, Dr. Qinglong Zhang and I are going to be going through the different forms of headaches and migraines and other things that go bump in the night, if you will, that don't allow you to sleep. You go to bed with a headache, you wake up with a headache, you walk around with a headache. But 18th, 6 p.m. at the Roselle Center for Healing in Fairfax. All you got to do is register. Go to drtomroselle.com or rosellecare.com and register for the class. The only thing that we ever ask you for is that if something happens and you can't make it, pick up the phone, call us, say, hey, listen, I can't make it. Do it a day before so we have room for somebody else and it's just not a last minute thing. And that we can say, hey, you'd like to come. But as you know, if you've been to our classes before, it's a host of all kinds of data and information. People say it's like drinking from a fire hose because we want to give you as much as we possibly can give you. So join us, okay? This is the 18th. Call, register right now as soon as the program's over or while you're sitting there on your phone, do it today. And please join us. And I promise you, this class particularly will give you tools to get a life back, to make you feel better, to give you energy, to not let you sit there, to not want to hurt somebody, meaning that hangry headache, right? Look, that's what we're talking about. We're talking about that emotional up and down. We're talking about the pain that doesn't go away. We're talking about the weakness in your system. We're talking about the dizziness that comes about when you neglect your system. So there's a whole lot more to that, but what's a person to do? So let's talk about that just a little bit and kind of walk you through the puzzle. How do we get rid of these stupid hangry headaches, these blood sugar headaches? And do we just want to blunt it or do we want to get rid of it? Well, I don't know about you, but I like to get rid of things, so I have a little margin of error every once in a while. So when somebody says you got to eat a well-balanced diet, how many of you go to your doctor and say, just make sure you're eating on a regular basis? What does that mean? You got to eat foods that are high in protein. You have to make sure that you're drinking a lot of water. You have to make sure you get rid of the sugar, the artificial sugars that are in your system. We have to make sure that you have a serving of fruit a day, not having maybe a meal a day and the rest of it's fruit and sugars and so forth, because that's going to drop you and make life even worse. So if you're consuming meals that are organic and they have high nutrient values, that's a way to start. But you have to make sure you're getting enough protein. What's enough protein? You hear, got to have more protein. You got to build. Listen, there's 2 times in your life that you want to make sure that your protein levels are really high. When you're young and you're growing and you're developing and you're going, and the other one is when you get older, kind of like me, and your body's breaking down faster than it's repairing. So you want to make sure the protein levels are high, because what happens is this: you still need the protein because they produce something called amino acids, and your body's going to get them one way or the other. And if you're not giving them adequate amounts of protein, it's going to eat you up. What does that mean? That's going to mean that you're going to eat your muscles up. And that's where you start getting this wasting effect, this sarcopenia effect. And anybody can do it. We see it with sick people. We see it with patients who have cancer. We see patients that are getting older and don't eat anymore. I don't want to eat, I'm not hungry anymore. By the time you get hungry, it's too late. You got to feed that system. And if you eat enough of the right things, your body will say, I need more, and get a little hungry, let's get it done, right? So how much protein should anyone get? It depends on your activity level, but minimum, and this is a minimum level. take the body weight that you want to be. So we'll use the typical 150, 160 pounds and multiply that by 0.5. So you come up with what? You're coming up with 75 to 80 grams of protein per day from all sources. That means you got to go out and eat a horse every day, or a whole chicken ranch or whatever it is. That means that from all sources, whether it's lentils and black beans and things of that nature. Broccoli's got protein in it, but you start adding it all up. Now, 4 ounces of meat, 4 ounces of chicken, 4 ounces, of fish cooked properly has what? Has about 27 grams of protein. So it's not difficult to get it if you're eating well. That's not that much. That's not that much. And you add other pieces into it and you start adding, but you got to eat it. And here's the deal. If you know you're getting these blood sugar type of headaches, these hangry headaches, here's what I want you to do. I want you to make sure you get some protein of some sort in your mouth every couple hours. It can be, maybe slightly under a quarter cup of nuts. It could be a hard-boiled egg. It could be a protein stick of some sort. It could be a protein drink. Food is always the best, that's cooked at home and not in the microwave. That's a whole different story because you're destroying the structure of the food by putting it in the microwave. Yeah, I said it. So we'll deal with that one of these days as well. But you have to avoid caffeine withdrawal. Does that mean you should be drinking all the time? No, look, consuming a cup of tea or coffee that's organic, that's low acidic on a daily basis with a lot of water before that can somewhat be helpful because it'll keep things in balance because it has high levels of polyphenols and keeps the swelling, the inflammation down. But not any more than that. I didn't say a pot of coffee a day. I didn't say, a quart of tea a day. I'm saying a cup of coffee or a cup of tea after you've had water might help keep things in balance and limit the problem. Now, the idea is to drop it down, so you're not dependent on that coffee. Now, maintain an eating schedule that is consistent and the same all the time. Now, do you have to have 3 square meals a day? No, some of you need about 6, and that means eating every couple of hours. Avoid these long fasts. Don't go 13, 14, 15 hours without eating because somebody told you it was the best thing for you. Now, intermittent fasting, 10, 12 hours a day, there's an argument that it does do some good for you. But think about it this way. You have your dinner, 7 o'clock, 7:30. If you're like me, I'm very European, Sicilian background. We eat about 8. But we don't go to bed right away. We're up, for a few more hours. And then next morning, I get up, generally about 5:45. And then I do a little stretching. I get a big glass of water. I talk to my creator. I do a little meditation. I start studying. And then generally late morning, about 8:30, I'm in the office by that point and I'm hungry. But I've already prepped food. I got hard-boiled eggs in here. I got some protein shakes. I got pieces of things sometimes the night before dinner that's already cut up. And in between patients, I go and I grab one. I put one in my mouth. And I try to keep my blood sugar from crashing. So consider, this intermittent fasting stuff that maybe you've gone too long. Now, in today's time frame, right now, we have what? We have Lent and Ramadan hitting at the same time. So a lot of people, whether you're Islam or you're Christian, you're fasting on a regular basis right now. Please do not go too long with nothing in your body because you're paying a price for it. I know it goes against your faith and your tradition and so forth, but I'm talking to you medically, okay? If the headaches are continually persistent and they become severe, you're missing something. And that missing something often is the long period of time that we're going without food. So think about that. Get enough protein? Are you eating often enough? Are you drinking enough water to flush the toxins out of the system? All of those things can contribute to blood sugar crashes. So we got to eat the way we're supposed to eat balanced meals, lots of protein, tons of vegetables with it and so forth. We have to make sure we're getting enough water in our system, get rid of anything that has added sugars into the diet, any fast-acting sugars like white potatoes and white rices and things like that, got to go. When you look at your plate, you should see a third of it should be a protein, right? About another little bit more than a third should be vegetables, and a small piece of it, if any, should be carbohydrate, like a sweet potato, like wild rice, like buckwheat, something like that, because they're really not bad for you, but in limited portions. Now, remember we talked about the caffeine. We have to make sure that, we maintain normal, regular schedules. We have to prepare ourselves around, our workplace, make sure we have things that we can grab and move forward with. If you don't, you're going to pay a price. And you don't want to do that, do you? You really don't want to. Look, hypoglycemic headaches are what we're talking about. And they do several things. They trigger the release of cortisol from your fight-flight system, your adrenal system. That cortisol is necessary in a limited amount. But if it's constant, it goes up and it stays hot because you're in a stress-reactive pattern. Then what happens? You got the shakiness, you got the fatigue patterns, you got the irritability, you got the vision problems. But here's the other pieces. Now your hormones are being affected. You want to talk about no libido, guys? You want to talk about irregular periods? You want to talk about, that all those hormonal shifts and changes that we normally get? That's one of the contributing causes to it, particularly in today's world. And we're seeing it on a regular basis. So if that's the case, if that's really, really, really true, I would encourage you that maybe we got to do something about it. Look, there was an article that came out of the Cleveland Clinic a while back, and I hate going to the medical sources, but some of you are impressed by those things. They said if your blood sugar levels become too low, and what they said, not because you're not getting enough sugar in your body, it's because you're not getting a dietary pattern. Here's what happens: you look pale, you have shakiness, you start these hot and cold sweats, you have headaches, you get nausea, irregular heartbeat, your heart starts flipping around. They say, what is that called? Atrial fib. Yeah, well, it could be because you're not eating well. Fatigue patterns, anxiety, irritability. That's where the hangry comes in, that you want to hurt somebody, really. You can't concentrate. You can't remember anything. The tingling, the numbness, particularly on your lips and your face and your teeth and your tongue and so forth, the cheeks. That is a blood sugar transport problem. And you can see it begin to progress, if you will. The signs are things like confusion. Now, behavior changes, your inability to do routine tasks. Yes, inability to do routine tasks because of this hangry headache that you're not doing anything about. You can't concentrate. Your speech will actually get slurred. You can't enunciate the way you should. Vision, you get like tunnel vision. When you have any, it's like, boom, somebody says something you can't remember 10 seconds ago, let alone what happened this morning. And another one is called nightmares. Some of you start dreaming at night, say, oh my God, where did that come from? It's called because you're not eating the way you're supposed to. A lot of patients, I'll tell them, look, before you go to bed, half hour, 45 minutes before you go to bed, I want you to eat a hard-boiled egg, or I want you to eat an ounce or two of a piece of meat that you had for dinner, and see if it keeps you under more in a deeper sleep and allows you not to react the way that you normally would otherwise. So you have to pay attention. You can even get to the place where you go into seizures if you're not eating well. Hypoglycemic patterns, severe hypoglycemia, can actually even put you into loss of consciousness because you're going to pass out. Your body doesn't have the ability to stabilize itself. But some of you who had these petite mal seizures, you just kind of stare out into space and they don't know why, and they can't find it. It's usually because of the blood sugar levels aren't doing what they're supposed to be doing. Isn't that interesting? So when you eat, your body breaks foods down and makes sure that the foods go into something called glucose. Glucose is stored in the body by glycogen, and it goes into the cells and the muscles. And if you have enough insulin, which is produced by your pancreas, you are able to push this stuff into your cells, and you fuel an engine called the mitochondria. Now, extra blood sugar is stored in your liver and in the muscles. And that's what we talked about, this thing. So here's what happens, right? You have all this glycogen, you have all this sugar that's stored in your system, in your muscles and other cells. But if you are eating tons of sugar, then it stays in there and you can't get rid of it. So you have to drop it down, increase the protein metabolism. Your body begins to utilize its stored sugar in a very controlled pathway. So what would do that? What can you take that will help you? If you're eating the right way, that's number one, that will help metabolize that and get that headache to go away. A couple of things. A good vitamin B complex. If you go to the website, you go to drtomroselle.com and you go to the store that we have sitting up there for you and go in and look for basic B from Biotics Laboratories or BioB 100. Next thing you want to do is get a little low level of chromium, about 200 milligrams a day. That helps with maintaining your insulin transport in your system. Just doing those two things all by itself. And by the way, a little zinc. Why? Why zinc? Because it helps you produce insulin at a very balanced level. But we have to look at the medications because they can trigger hypoglycemia. Go to drugs.com, put things in, for example, something called quinine that is used to treat for malaria. It has some problems when it comes to blood sugar transport. Check it out. Excessive alcohol drinking. We talked about that. It can be problematic. So we have to look at an ongoing basis, but you got to watch that long-term fasting. It's not okay. Anything above 12 hours, in my opinion, unless you're doing it on a detoxification basis, you're home, you're sitting home, you're resting, should not be any longer than that. Again, that's made based on the experiences I've had for 49 years next month. And we have to make sure that we support adrenal function. Ladies, your adrenal system that produces your cortisol is what produces your hormones after you're done menstruating. And if that's not working the way it's supposed to, you got a problem. So you have to look at the complications of some of these things that we set aside, right? The dizziness, the weakness, the imbalance, the falls and injuries, the accidents that come about because our body can't function the way it's supposed to. Look, there's so much that you have to be with. We're coming up to a break. We have to pay attention to our sponsors. You're listening to Ageless Health with yours truly, Dr. Tom. Don't go away. I got a lot more to dump on your plate. Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use. So I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Red wine is high in a substance called resveratrol. The so-called miracle molecule found in red wine might help improve mobility and prevent life-threatening falls among older people. Mobility problems are particularly common among older people who have Parkinson's disease and other age-related neurological disorders. The research says that this important finding could lead to the development of a natural group of products designed to help older Americans live safer and more productive lives. But before you stock up on red wine, Dr. Jane Kavanaugh says that you can get this naturally occurring substance in larger and pure amounts through dietary supplementation. Red grape juice, red grapes, blueberries, and nuts supply the same amount of resveratrol as red wine. If you're trying to stay upright, do core training exercise, eat your veggies, take resveratrol supplements, and drink red wine in moderation.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Hey everybody, welcome back. You're listening to Ageless Health with yours truly, Dr. Tom. Got a great program lining up for you coming up on the 18th at the Roselle Center in Fairfax. Those of you in the area, join us. You got everything to gain by coming to these programs. You go home with a ton of data, a ton of information. And, if you want to get information beforehand, go to our website, go to drtomroselle.com, or actually go to rosellecare.com. Go to the office website, rosellecare.com. Go to the top of it. It says courtesy 20-minute consultation. Call us. One of my guys will get on the phone with you. These are brilliant doctors. They know functional medicine inside out, and they'll talk to you. Ask them questions, and they'll make it happen for you. So let's kind of recap everything that we have gone over. And I want you to understand that these chronic headaches, and migraine headaches, but this one that we're talking about is what? We're talking about hangry headaches. The blood sugar drops and you don't know who you are anymore. And it's a lifestyle situation. You're the cause, but you know what? You're the cure. You're the fix. You're the one that can turn this thing around. So I want you to understand that if you really get that you're in control, if you really get your body needs a balancing act of good nutrition and proper breathing, a little bit of exercise, lots of water, and you're going to be okay. But here's the deal. Let's do a gut check, all right? Let's figure out if we're in that park to begin with. Do you get up in the morning and kind of feel dull and you just can't get going? It takes you a little bit of time to, really get your head together and a little clarity. If that's the case, that's check number one. Check number two. Do you crave things, like coffee? Do you crave things like sugar? Do you crave things that, chips and dip and things like that? Let's probably check again. Why? Because your body's trying to metabolize blood sugars as quickly as you possibly can. So if that's the deal, guys, if that's the part of the deal, and you've weakened and you got these headaches and it feels like somebody's sitting on your eyes, in the back of your head, and it's around the front of your forehead and the side of your temples, and you get up too quickly and you're a little dizzy, you look at the bright sun and it hurts you. Remember what I just said? If you look at sunshine directly without sunglasses on, it actually hurts your eyes. That's another indicator that you have a blood sugar type of headache. It's chronic at that point. It's been around for a long time because it's affecting your adrenal system. It's affecting your fight-flight. Now, if you're getting enough of the right types of foods, and what are we talking about? We're talking about proteins, and we're talking about eating every couple of hours if you need to. We're talking about getting enough water. How much water? You should be getting about 6 to 8 ounces of water minimally every hour that you're awake. Don't just chug it down, sip on it. Put a little salt in it. Put a little Baja salt. Baja Gold is one of the best out there, or a little Himalayan pink salt. And what am I talking about? A third to half a teaspoon. It's not going to hurt you. It won't raise your blood pressure, I promise. And you'll find that will settle your system out as well. Instead of grabbing that cup of coffee and that candy bar, why don't you have in your drawer some protein that is organic that you can reach over, grab in, and pop it in your mouth till you get to lunchtime, and then break for lunch. Go get some lunch, even if it's 20 minutes, half hour. Go get a little piece of protein and some vegetables. It's important. You have the capacity to turn these type of headaches around because they can go into migraines. They can go into all kinds of ongoing problems. If you have mold and fungus in your body and you're drinking alcohol on a regular basis, or you're eating that candy bar, those headaches that come from that are a result of a byproduct called aldehyde, which is alcohol. And it gets in and it increases the swelling, the inflammation within the vessels within your head. I don't know about you, but I think we made them watch that, right? So what kind of nutrient bases will help this? Well, we mentioned a few of them, but I'm going to add something else, magnesium as well. Magnesium is really important. The ones that you should look at are things like glycinate, because it helps transport into the muscle of the body. You're going to look at chromium. You want to do about 200 units a day. You're going to look at a little zinc as well, and B complex. That, in addition to changing your dietary patterns and getting some exercise. You don't have to get a lot of exercise. You can sit in a chair and you can begin to twist a little bit and breathe normally. Go out for a walk for about 5 minutes out, 5 minutes back. If you start doing these things, as long as you're functionally capable of moving your limbs slowly, incrementally, stacking, you're going to be surprised how your life will change. I promise you. But look, coming up on the 18th, in about a week and a half from now, join us here at the Roselle Center in Fairfax, Virginia. Call us, make a reservation. All you got to do is go online at rosellecare.com, ROSELLECARE.com, rosellecare.com. Join us. I'm going to give you so much information. You say, I didn't know that before. Dr. Zhang is going to flood you with information. He's an amazing practitioner, amazing Oriental physician. And we call him TCM, Traditional Chinese Medical Physician. And he's a chiropractor on top of that. And he understands this intimately. So please join us. And we'll give you as much data as you possibly can. And by the way, just to recap for my friend who reached out to me, it's no pressure. It's not a timeshare. We're not going to sell you anything. You take the information. The only thing I want for you is to have this. You know why I'm so certain? It's because I know the things that we teach will trigger your interest and maybe taking an action step to help yourself. And if I never saw you again, and I knew that I changed your life, that's all I want. That's why I'm still here. That's why I do what I do. Look, you can shift and change anything about you, but particularly these crazy headaches, particularly these blood sugar transport headaches. Most of you eat like garbage. The sugars, the sodas, the coffee, the black teas, the fast foods, the fried foods, the alcohol, the gluten, the additives, preservatives, the GMO products. Sound familiar? How about now would be a really good time to change it? I don't know about you, but maybe, let's get it done. Let's start moving things the way they're supposed to be moved into a state of health. Ageless health, my friends. It's your right, providing that you're willing to take the responsibility to make it happen. It's not dependent on somebody else. It's not say, take this drug for the rest of your life and, we'll see what happens. It's not this, goofball stuff that they're advertising now on weak pancreatic insufficiency type of thing. We've known that in the healthcare field for years and years, but there's ways of fixing that and turning it back on. You want to find out? Join us on the 18th, and we'll show you what to do about it. I promise you, you're going to go away with all kinds of data. It's going to be fun. We're going to have a good time. I enjoy meeting all of you anyway. I love showing off my practice and my staff and what we do. So if you want to get well, if you want those crazy headaches to go away, if you want that pressure to leave you, when would now be a good time to take advantage of it? Remember what I said? You're the cause, you're the cure. So let's step up and make it happen. Make it, your intention for the rest of this year, 2026, to get your life back. And it may start with just getting clarity so you can think again, so your headache can stop pounding, so you can do the things that you need to get done. Look, my purpose is to serve you, to serve, educate, and empower you, not me, you, and make sure that you have all the tools that you will ever need to have a great life, an ageless health life, one that you deserve. And sometimes the only one that gets in the way of that is you, just you, nobody else. So if that's the case, how about getting the tools that you need to have to make that happen? How about making a commitment to yourself that, I guess maybe I've been messing up. I've been screwing up pretty good. It's not okay. So if that's the case and you're willing to do it, we'll show you how to make it happen. Just join us. And we'll do that for you on the 18th here at the Roselle Center in Fairfax, Virginia. We're coming up to that place of the program where I'm going to have to say, we'll keep you here next week with some more information, more that you can stack together. I do it for one reason, ongoing basis, one reason only. One, it's my purpose to give you all the information that you could possibly want and need to change your life. But also, more importantly, and truly from my heart to yours, is simply this. I love you all. You have a great time. You know how to find me. Reach out, send me a note. Go to drtomroselle.com and say, hey, doc, what do you think about this? And I promise you, I'll answer you. See you next time. Take good care of yourself. Bye-bye.